Alright, so to start off, I'm just going to show you my charting paper. So I'm going to be using this throughout the whole immunization process. I'm going to start off with some hand hygiene. Okay, I'm going to pull out my syringe and my needle, my 2 alcohol swabs, and my cotton ball. Hello, my name is Trinity. I'm a nursing student at Medicine Hat College. I'm going to be giving you your influenza vaccine today. Would you be able to confirm your first name and your last name, please?
Tina Lane,
Okay, and your date of birth, please.
November 29th, 79.
Okay. And have you had the influenza vaccine in the last year, so the 2022 flu season?
No.
All right. And do you live, work, or go to school in Alberta?
Yes.
Okay. Are you well today?
Yes.
Okay. Have you ever had an allergic reaction to a vaccine?
No.
And are you allergic to anything?
Nope.
Okay. And do you have any pre-existing health conditions that require a doctor's visit annually or all the time?
No.
All right. Is there any chance you're pregnant?
No.
And are you on any medications?
No.
Okay. So I'm going to be giving you the influenza vaccine. So do you know what influenza is?
No.
So influenza is a virus that affects the nose, throat, and the lungs, okay? So the vaccine we're giving you is putting antibodies of the virus in your system, so your body will be more ready to attack the virus, okay? So if you're in contact with influenza after you get this shot today, your signs and symptoms will be lessened significantly. Okay, so there are 4 strains to the vaccine this year. So there's 2 A strains and then there's 2 B strains. So the A strains are A Darwin and A Victoria, and then the B strains are B Phuket and B Austria. Okay. So the side effects of this vaccine, they vary from person to person. So the most common one is redness or swelling in your arm. This can be helped by putting a cold cloth or an ice pack on, or also taking Advil or Tylenol or any painkiller that you prefer. Another one is a headache, which you can also take Advil or Tylenol or any painkiller you prefer. And then another one is a fever. So for a fever, you could take off some clothes or you could put a cold cloth on your forehead. And the most severe side effect is anaphylactic shock, which happens but not as commonly. So I just want to warn you about that. That is why we get you to stay for 15 minutes after we inject you with the vaccine, just to make sure that everything is good and to make sure that you're safe, because we do have an anaphylactic kit here on site, so it's more safe if you stay here so we can help you out. Okay? Do you have any questions for me?
No.
Okay. And I'm going to be giving you the vaccine in your deltoid muscle. So it's right about in this area of your arm, okay? What arm would you prefer? What's your dominant hand? I'll do the opposite probably.
The left.
Okay? Okay, so you want it in the left arm?
Yeah.
All right. So do I have consent to
Yes.
giving you the vaccine? Okay. Okay. Alright, so I'm going to perform some hand hygiene. I'm going to open my syringe very carefully so I don't contaminate it. Hold it. I'm going to open my needle also very carefully so I don't contaminate it. I'm going to put this in the garbage. Okay, I'm going to set this needle on my clean fields. I'm going to pull my vaccine out of my cooler. I'm going to make sure it's between 2 and 8 degrees. It is. I'm going to check the expiry date. It's due in 2028, so we're good. I'm going to write down my lot number here. Okay. I'm going to make sure it's the influenza vaccine. So influenza vaccine. I'm going to make sure there's no particles or discoloration here. It looks good. I'm going to agitate it. And I'm going to show my client. So this is the influenza vaccine that I'm going to be giving you. I'm going to be giving you a 0.5 ml dose of it today. Do you have any questions about this?
Nope.
Okay, I'm going to wipe the top of the bottle. Putting this in the garbage as well. Okay. I'm going to inject 0.5 mils of air into the bottle. Okay. And I'm going to fill the syringe up to 0.5 mils, tapping out any of the air bubbles that may exist in it. I'm going to double check that this is the influenza vaccine, and it is. Okay, and then I'm going to put it back in my cooler so it stays cold. Okay. I'm going to do hand hygiene. I'm going to find the acromion process. I'm going to find the acromion process. Then I'm going to find the deltoid muscle, which is right here. I'm going to clean the area, make sure it dries. Hold this. Okay, and I'm going to give you this cotton ball so you can put that on your injection as soon as I am done, okay? All right, are you ready?
Yep.
Okay. I'm going to go in at a 90-degree angle. I'm going to pause, make sure there's no blood. There isn't, so I'm going to slowly administer the vaccine. I'm going to lightly just pull it out really nice. And I'm going to eclipse the needle and throw it in the sharps container. And then I'm going to perform some hand hygiene. All right, so you are complete. You have been vaccinated for the flu zone for the 2022 season. I'm just going to get you to wait in the waiting room for 15 minutes just to make sure that everything is good, that you don't have any anaphylactic reaction, and then you're going to be free to go after 15 minutes. And then I'm just going to finish this documentation here. Gave it in her left arm. 26th, and then okay. And there's the final immunization paper.